My name is Dr. David Santos. I'm a board-certified otolaryngology head and neck surgeon, and I work for Proliance surgeons. And I got my undergrad at University of California, Berkeley, medical school at Tulane University in New Orleans, and then I did my residency in the Bay Area, UCSF, UC San Francisco, as well as Kaiser Oakland. And have been a board-certified surgeon in the Seattle area for over 20 years. We have a state-of-the-art surgery center whereby we do all our otolaryngology procedures, and it has all the technology and capabilities to do the bulk of ENT-related surgeries. I think we have an excellent group of surgeons, some of the top surgeons in the Puget Sound area, primarily ENT as well as orthopedic. But these are a strong group of surgeons who know their craft. It's great to be a part of this group because we're with a high caliber board certified surgeons, and it's the largest one, I think, obviously in Puget Sound area. So I think it's real important to deliver as much possible to our patients in terms of education, in terms of time, in terms of TLC. Obviously our patients come in with needs, and we try to meet those needs as best possible. Oftentimes that means surgery, oftentimes it means medical treatment, oftentimes it means other things. And so it really is to step up and provide the best TLC to our patients as possible. So some of the more important aspects of surgery in our clinic is related to allergy and sinusitis. Chronic sinusitis is extremely common, extremely problematic, and so sinus surgery is one of our expertise. So chronic sinusitis, again, is a very common malady in the United States. Literally millions of people suffer from it. And so what we're able to do for many of those individuals who don't get better with conservative medical treatment, we're able to really impact their lives with endoscopic sinus surgery, which includes a lot of technology improvements that we have over the years, including image guidance and sinus shaving and balloon dilation and so forth. These things provide an even better result for our patients, and the success is well over 90%, and the satisfaction rate is huge. And it's really for those individuals that have had literally months and months of suffering from sinusitis, headache, pressure, pain, can't breathe, etc. So it's one of our most fulfilling, self-fulfilling surgeries that we have, and it has the highest satisfaction rate, I think, with our patients too as well. So I fell in love with ENT way back when I was about 25 years of age. When I first saw the surgeries being performed in the head and neck area, it was very, very easy to say, this is for me, this is what I'd love to do, and never looked back and never felt that was a wrong decision. It was always a right decision, and it's going to be very difficult to stop in the future, if ever. Avid health enthusiasts, and so it's not just otolaryngology or ears, nose, and throat related problems, but just overall total health, whether it's mental or particularly diet-wise, health-wise, exercise-wise. And so this is always part of the equation and part of the discussion when I see my patients. But it's also something I do on social media a bit, particularly on Twitter and a little bit on Instagram, in regards to promoting and talking about and commenting on what's the best answer today for best health, whether it's dementia and preventing dementia, whether it's staying in shape, keeping in good condition and so forth. A lot of things that can be discussed with our patients, and it is part of being able to recover from a surgery. You got to be in good condition, you got to be in good health, and when there's compromise to that, whether it's staying up late, drinking too much, smoking, those sort of things. Of course, that's going to impact the outcome of the many surgeries that we do. But also, after you have the surgery and you've had the benefit of the surgery, then what are we going to do going forward in terms of taking care of yourself? You've taken care of this problem. What about eating right, going to sleep on time, having the appropriate diet, staying away from all the bad things that we know about?